Medical Practitioner 1. Practitioners. In Britain, doctors, also known as medical practitioners, must be qualified, have a university degree in medicine. They must also be registered, including in the General Medicine Council list, or registered in order to practice. A doctor who treats patients has opposite to one who only does research is called a clinician. A doctor who provides primary care of patients is not as a general practitioner. Or family doctors, GPS, usually work in a group. Largest group practice work in a building called a health centers. Season B. Specialties. Specialty doctors of explain pediatrics, general work in hospital. However, those who work on site, the NHS providing private health care might have consult rooms outside a hospital from explain in the famous Harley Street in London. The two main practices of medicine are surgery and internal medicine. At the doctors who practice these branches are surgeons and physicians, respectively. In Britain, male surgeons are addressed as Mr. and females as Mr. Dr. Smith is a surgeon and Mr. Smith is a surgeon. A cardiologist, a geriatrician, and an anesthesiologist, especially in diseases of the heart and circulations or cardiology, diseases of impending pains or geriatrics, anesthesiologists. Nelson C. Sourcing and Specialty. 5.1. White sentence to describe the work of the specialty in each branch of medicine. Look at B options to help you. Number 1. Dermatology and dermatologist, especially in the aspects of the skin. Rheumatology, especially in diagnostic and treating diseases that affect the joints. Traumatology, especially in treating injury caused by accident of psychical trauma. Pediatrics, in the medical care of infants, children, and adolescents. Obstetric, especially in pregnant children and post-pregnant care. 5.2. Complete the table with work from A, B, and C opposition and relate forms. Put a strict mark in front of the strings syllably in work. The fifth one has been done for you. Verb, especially practice, consult, assist, graded, qualified. Noun, personnel, specialists, practitioners, consult, assistant, graded, qualified. Act 5.3. A pathologist, especially in diagnostic, the assess through examination, solve, and treat. A pediatrician must enjoy working with children. A oncologist is interested in the diagnostic and treatment of cancer. A psychiatrist must be good at counseling. A neurosurgeon must be good in her hands. 5.4 Make work ambitions using a work from X books. Two works can be used in three. Look at B and C, A, B, C, opposite to help you. Consulting is rooms. General is practices. Group is a specialist. Here a centers. Internal is medicine. Is usually is a specialist. Medical practitioner 2. Hospital staff. The people who work in any type of workplace, including hospital, are called the staff. The medical staff is in British hospital belong to one of four main groups. L.G.D. Hastings, house officer, or house officer in a nearly graduate doctor in the first years of postgraduate training. After a year, he or she becomes a registered medical practitioner. Medical time, consult, physician, and surgeon are responsible for a special number of patients in the hospital. Each consult has a team of junior doctors to help care of two patients. In my hospital, these are multidisciplinary teams which consult not only of doctors but also of physiotherapists and other kind health professionals. 6.1 Make work ambitions using a work from H box. Look at and A, B, and C opposite to help you. Society, especially house, office, on call, province diagnostics, radio power, was round. 6.2 Make the discrepancy with the job titles. Look at B and C opportunities to help you. Dr. Haman has been a pediatrician of 8 years and is responsible of treating the children admitted to work says. Is C consult. Dr. Stewart has just started the second years of the foundation program. Is season D as she O. Dr. Phillips has just graduated and is working at largest hospital in Birmingham. Is A. Dr. Milley is the surgeon of the hospital and the medicine staff in the Birmingham Hospital. Is B. Medical director. 6.3 Are the following statements true or false? Find reaction of your anyways in B and A, B, and C opposition to. The system of training doctors in Britain is calling the Fusion program is true. The name Senior Home Office is no longer used in Britain through. The person is usually the three doctors to see patients. False. The working is thrift. All doctors take turns to be on call. Is true. 6.4 When you get to your work, the first thing into is talk to the half officer who's when on duty during the last on calls train to find out if there have been any new admissions. Number 7 Nurses. A. Nursing grads. Nursing working in the hospital have the following grades. A student nurse, a nurse who is training. Staff nurse, a nurse who has completed the training course. Training nurse, a more special nurse who is the charge of or responsible of a working of department. Nurses manager, a nurse who is the charge of serving awards. B. Support workers, the clinical support worker who has done a short course at very basic qualifications, and the nursing auxiliary who is usually unqualified but assisting nursing staff. 3 may also be qualifiers. Choosing do include make sure parents, notes, and information are up to date at and with the telephone. Specializations like doctors, nurses, came specialists. And midwife, as especially from the beginning, be done. A coursing is midwife, the management of pregnancy and children with. The nurse role. The nurse role has changed considerably in recent years in the ambition to general pains, care, children, temperatures, pulse doctor and blood pressures, children dressing, hearing injectors, and removing sutures. 7.1. Complete the sentence. Look at A, B, and C opposites to help you. Number 1. Someone who especially in delivering babies a midwife. Number 2. Someone who is qualified to assist a nurse in a clinical support worker. 3. Someone who is not qualified but is able to assist a nurse is a nursing actually. A nurse who is qualified is a staff. A nurse who is a quality is a help promoting is a help visitor. A nurse who looks after a ward is a cheering nurse. A nurse who works in the community is a district nurse. Someone who analyzes the work telephone is work clean. 7.2. Make work conditions using a work of principle from a box. Carry out is a product. Chain is a dressing. Check is a the temperature. Heat is a injection in removal sutures. 7.3 is a complete sentence with the contrary grammatical of perform. An isotopy, brain, skin is paling and yes to perform. Using biopsy of the pancreas has performed last March. Is a prion condition deteriorate, a laboratory should be performed. If a diagnosis of meningitis is suspect, a lumbar punctures must be performed. Last year will be performed around Miss W. Grom study. 7.4. Complete the sentence with the correct grammatical of all carry up. Enough enter to carry up a large study. Unfortunately, feed properly consent threads love between it so far. Are professionals. Make word combination using a work of H box. Look at A, B, and C, and D option to help you. Ambulance is techniques, artificial limb, club food, control limb, hair professional, intern collaboration, occupational therapist is social worker. With all health professional comes to be help for young people. Look at B, A, B, and C, and D opposed to help you. A bearded lady woman who was used at BB school water. Someone who need glasses. Opposition. Complete the text. Look at A and C opposition to help you. Number 1 is ambulance. Number 2 is lean. Number 3 is therapies. Number 4 is rehabilitations. Number 5 is arteries. Number 6 is deformity. Number 7 is revealing. Number 9, hospital. Entrance to a hospital. Jordi Pont is a 4 years medical student of Barcelona. He has come to retain of an selective attachment to the Royal Infirmary Edinburgh. Dr. Baron is interred into the hospital. Dr. Baron. The Royal Infirmary is the name of the University Special Hospital of Edinburgh University. It is a general hospital dealing with all types of patient illness except pediatrics. We have a specialty hospital from the northern part of Edinburgh, the Hospital of Sick Children. You can see some of the pediatricians in your hospital of the scene. Outpatients, Dr. Baron. The accident and emergency department also can casualty is when patients who are in quality in with a sudden serious condition come off assessment and treatment. A parent who have an appointment to see a specialist go to clinic in one of the open parents department. They have usually been referred to the hospital with there. 9.1 Complete the table with work from A, B, and C option, but a straight making from the three things work 1. Verbs admit, assess, disargue, operative, refer, treat. Noun admission, omissions, assessment, disorient, operations, refer, treatment. 9.2 Make a work of combinations using a work of H books. Look at C option to help you. Quality is lean. Assessment is unit. On is duty. Referral is letter. Waiting is list. Number 10. Primary care. The National Health Service. The National Health Service is responsible of health care of every joint in the QC. Primary care is preventing behavioral practitioners. Nurses, dentists, practice and options. The practice team. A typical practice employee receptionist. They are responsible of initial pain, contacting, making appointments, taking records of reset procedures, talking messages from parents on our health care provisions. The practice manager has responsibility of finance and sometimes of T and ET. Super reception staff your locus helps prepare the practice development plan. Practice nurses have diabetes and cardiovascular disease clinical as when has 1-2 clinical practice of 2-1 visits to herpes. 10.1 Complete the sentence. Look at B to help you. 1. Children over 67 and people with some chronic disease to now have to pay prescription care in the UK. Parents with mobility problems may be unable to go on the home visit. The having a option is in the learn menus. 10.2 Make word combination using a work of passion for bigs. One word can be used through look and A and B option to help you. Char is the greasing, make appointment, perform minor surgery, refer a patient, room a clinic, supervise staff, take masters. 10.3 which member of practice team use responsibility of each of the following. Look at B option to help you. Rooming a clinic of pregnant woman, midwife. Teaching a parent who is stringing his broken leg, physiotherapist. Leading the happier now touch a petting cat can come to her opportunity receptionist. Ruining a clinic of people who want to lose weight, practice nurse. Vincent a parent who has who's raising him after a nearing hospital disease nurse. Carrying up check-ups on children in a poor neighborhood her visitor. Organizing cover of an used doctor practice manager. Complete the diary of doctor's survey like at B and C option to help you. Number 1 is surgery. Number 2 is appointments. Number 3 is receptions. Number 4 is visit. Number 5 is precisions. Number 6 is refer. Number 7 is hold. 11. Medical Education 1. Medical Education in the QC. Medical education in the QC covers undergraduate education of the 5 years at medicine school, the section of a university's responsibility of medical education. A 2 years foundation program, it provides training of need doctor after graduations that a series of conceptment is different specialists. Postgraduate training which doctors take to become of consultant senior specialist offer daily through jargons of different specialists of explain the Royal College of Physicians. Continuing profession development in the form of courses and sharing with doctors either take of doctor in the working life to job to doctor. Extract from undergrad preparations. A student with healing and medical study described because 11.1 make 3 activities to the setting of medical education in the QC. The key in giving in a opportunity. This is covering early stage of medicine education. Keeping a loan of surgery care, pressure, observe and perform clinic experience. Number 3 is specially retention. Number 4 is specially retentions. Number 5 is continued education specializations. 11.2 is elective training. Number 3 is tutorial. Number 4 is clinical practice. Number 5 is medical ethics. Number 6 is academic. Number 7 is medical school. Number 8 is consult. Number 9 is scholar. Number 10 is guest. Medical students 2. The foundation program is a 2 years training program is from the between University 11 study has medical school and has special or original practice training is consisted of a series of principles. Complete the points with words from the books. 2 principles can be completed in the 2 different ways. Look at A and B option to help you. 1. Assess. Number 2. Supervise. Number 3. Deliver. 4. Take. 5. Demonstrate. 2. Make the 2 parts of the sentences. Look at A B, and C option to help you. Number 1 and FE is a doctor is number D. A demonstrator is an anatomy teacher is a H. A clinical training is a consult is F. A supervisory consult is B. A medical school is G. A placement is C. A corrigan is A. A favoring is a specialist is E. 12.3 Why is full the qualifications of doctor and children look at C option to help you. The organs doctors type of register to manager and three patents is the QB. A doctor's most requisition is the general medical country. 3 are several types of registrants. Running registration is from doctors who have used qualified from medical school in the UK or from certain European economic area. Full reception is for international medical reps who have not completed the equivalent of years clinic training in the UK. Plan B, before they come to the registration, some category of already doctors are revising take the professional and linguist assess word test. Part 1 consists of the test of knowledge. This as actors. Part 2 is ability structure clinical examination. 13.2 Why the abbreviations is work. Look at A and B and C option to help you. 1. Any doctor who wants to do work in the UK use register with the general medical council. Some overseas doctors must pass the Plan B, the PL and B the test before they can register. Professional and realistic access for. 2. There was a OSCE Hub TV structure clinical examinations. In any emergency, remember the ABC protocol. Airway, breathing, circulations. Before can you breathe in a special register, you must have a CCT certificate of complete of training. Number 1 is limited register. Number 2 is KMC. Number 3 is SPLAB. Number 4 is OSCE. Number 5 is full registrations. Number 6 is CCT certificate of complete of training. Number 6 is specially registrants.